A second American aid worker who contracted Ebola in West Africa has been released from a U.S. hospital. Dr. Kent Brantly became infected with the disease while caring for patients in Liberia. Nancy Writebol was discharged on Tuesday. Each of them underwent treatment with an experimental drug. CBC's Lindsay Duncombe is tracking all of the developments and joins us live now from Washington. So, Lindsay, Dr. Brantly spoke briefly at a press conference today. What did he have to say?
Well, it was actually pretty nice to watch him walk into that room with all the reporters. There was a lineup of healthcare workers that were waiting to greet him. As soon as he walked in with his wife, there was applause. We heard a little before he was thanking the people that helped him there, thanking the healthcare workers as well as repeatedly all of the people who prayed for him, who prayed for his recovery. He went to Liberia to help people. This is a man who is guided by his Christian faith and who repeatedly thanked his God as well as all of the people who used their faith to pray for him and, in his mind, help him get better. And he also was, the very last thing that he said was that he really wanted what was learned by his treatment at the hospital here in the United States to be used to help the people in Liberia where he was working and in West Africa where so many are still suffering. Here's what he had to say about that.
And I'm glad for any attention my sickness has attracted to the plight of West Africa in the midst of this epidemic. Please continue to pray for Liberia and the people of West Africa.
So, Lindsay, one of the big questions now is how can this treatment these two Americans received help people in West Africa in terms of the treatment going forward?
Well, the doctors answered that at the news conference, and they think it can help in a number of different ways, because really the big difference between how people are treated here and how they're treated in the hospitals in Africa is the infrastructure and the fact that this is a hospital, Emory Hospital, where people go to learn. So, of course, all of the different things that they do, such as the amount of fluids they give or the electrolyte balance when they're trying to rehydrate someone with the virus, that's all measured. And, you know, how blood clots worked, that's all measured. So what they can do now, say the doctors, is share what worked. And even though the folks in Africa may not have the same kind of tools to be able to measure, they can say, you know what, try this, because it seemed to have some effect when they were treating them under these conditions in the United States. As for that experimental drug with the Canadian connection, ZMapp, that was administered to both of these aid workers while they were still in Liberia, there's been a lot of publicity about whether that was the thing that really helped them get through it. But when doctors at Emory were asked about that, they didn't go there. They said basically it is so new and testing the disease in North America is so new that they really don't know. Here's how they answered the question about the experimental drug.
They are the very first individuals to ever receive this agent. There is no prior experience with it, and frankly, we do not know whether it helped them, whether it made no difference, or even theoretically, if it delayed their recovery.
Now, they also asked if there was any concern that they could still be contagious, and if there was any doubt, you should have seen the doctor hugging all of the people who treated him. Lots of hugs, lots of tears. There was little question that anyone here thought he was contagious, and of course, his blood and the blood of the other aid worker has been tested, and under protocol, they have, no signs of virus in their blood, and they haven't had symptoms for days. That's the protocol that allowed them to be released. But you can imagine, after having been treated by these people in isolation, wearing all of those masks and all of those suits, how nice it must have been to give them a hug and thank them for caring for them.